So we have been discussing so far that the 45 minutes time that you get in the writing test, you divide that time mainly into three or four stages, right? And we have been discussing how you would be approaching each of the stage. For example, the first 5 minute time, which is your reading time, is the time for you to interpret the case notes. Okay, so the writing test is kind of an integration of your reading skills as well as your writing skills. So, how well you are able to interpret the case notes. That is something also being assessed here. So the first step towards your writing is you interpret the case notes in the initial 5 minute reading time that is given to you. That is exclusively for reading, which means during that 5 minutes time, you can't hold pen or pencil, you can't take notes. It's strictly the reading time. So the first step for you is that you interpret the case notes. You read them and you try to understand the background, the patient's medical conditions, social conditions, care requirements, and why the referral is being given. So I have taught you the 5 step strategy for interpreting the case notes. There are certain steps that you follow when you are interpreting the case notes. Okay, we discussed that in writing session 1. Then the second step for you, once that 5 minute time has ended, is task reduction. What you do here basically is you select relevant case notes. And we also have had a session on this. We discussed this too in the writing session 1 as to how, keeping in mind the purpose of writing the target reader, you will decide what information is relevant and what information is not relevant. The third step for you is planning or organizing case notes. Here, what you do basically is you decide whatever information you have selected, how are you going to put that into certain paragraphs? What would you write in which paragraph? How many paragraphs would you have? And this is very crucial, your ability to group the relevant information and your ability to prioritize the most relevant information for the target reader is something that is being assessed here. And once you are done with that, the fourth step for you would be to transform case notes into grammatically correct sentences. This is something very important because there's a language test, uh, and your ability to communicate effectively in the written format is being assessed. So how well are you able to transform the case notes? How accurately are you able to transform the case notes is something being assessed here. So the case notes usually are given in the note form, which means in order to make it into a complete sentence, you may need to add prepositions, you may need to add articles, you may need to add verb or helping verbs, and in certain situations, you may need to club multiple notes together into one compound or a complex sentence. So when we looked at different aspects of grammar, we have looked at different ways in which you can ensure that the sentences you are forming are grammatically correct. For example, the tenses that we learned how would you write a sentence in active voice, how would you write sentence in passive voice, using different tenses depending on what kind of situation it is. And we have also learned how to write compound and complex sentences, which is basically when you are combining multiple notes into one sentence. So what we would be doing today is we would be mainly, taking sets of case notes and then I would be giving you an opportunity to transform those case notes, and I'll then be giving you feedback on what you have done. We'll be discussing it as a group whether one way of summarizing it correct or the other way of summarizing it is correct. I would try not to become too technical about the grammar because the focus today is not the grammar, but still we'll have to ensure that the sentences you are writing are not grammatically incorrect. So let's begin. I'm getting the notes on screen. So as I said earlier, transforming case notes. Now, when you are transforming case notes, you may be writing a single compound or a complex sentence using multiple case notes, or you may be writing a paragraph using multiple case notes. So each paragraph that you're writing within your referral letter or transfer letter or discharge letter serves a specific function. So when you are transforming case notes, you'll have to keep in mind uh, whether that particular paragraph is serving the function that you have decided for that particular paragraph. So paragraph function is something that is connected to both the stages of your writing. Organizing information, when you're organizing, you'll have to think which paragraph will serve what function. And when you are converting or transforming those notes and when you're actually writing a paragraph, you'll have to make sure that whatever you have planned, you were able to implement that when transforming the notes. So let us look at some of the common paragraph functions or some of the common types of paragraphs that we use while writing referral letters. So I'm sure all of you might have heard about the ISPA format or SPAR format. While writing referral letters or while giving handovers, we often use this as a healthcare professional, particularly when you're communicating with another healthcare professional. So what does the S mean? There is a situation. So you include the patient's name and explain your concerns about the patient. So that is your situation paragraph. Then you may have a background paragraph. This background paragraph will be stating the reason for presenting, if there is any relevant medical history to that particular presentation, and if the patient has taken any medication related to that particular problem. You may be compiling all of that in one paragraph, and that would become your background paragraph. You can have assessment paragraph. This talks about the patient's current condition. What is their situation at the moment, or when you are writing the letter, when you are sending the referral. And finally, you will have a request paragraph, which will include your suggestions or your recommendations or the patient's needs or their wishes about their treatment or about the care plan. And if you're writing a discharge letter, then the meaning of this ISPA would change slightly, because when you're writing a discharge letter, your situation should include why were they hospitalized, when were they hospitalized, and their overall recovery. Because see, introducing situation is like a brief summary of the whole situation, right? That is why it is introducing situation. That is your introduction paragraph, when you are giving them a brief idea about what has happened so far with this patient. So if you are writing a discharge letter, your introduction situation, the situation paragraph would include these things. Then the background paragraph here, rather than it including the background medical history, it would include the treatment and the medication that patient has received in the hospital, if the patient suffered from any complications, or if they have received any specific medications, or how was their overall recovery. That would become your background paragraph. Basically, when you will be describing their stay in the hospital, okay, only the abnormal things you'll be writing that particular paragraph will serve as background paragraph. Then you may need to add some additional details depending on who the target reader is and what the purpose of writing is. So you may add some information about the patient's home situation, some need related to physiotherapy, lifestyle modification, or diet program, or any other allied healthcare professional who is involved in the patient's care. So that will be here, instead of having assessment, you will be having additional details. And finally, again, you will have the request paragraph, which will include the discharge plan, such as monitoring, educating, if there is any need for further investigation, and the level of assistance that your patient requires. You will need to, however, remember that uh, the mnemonic S bar may not always be relevant, particularly when we talk about the sequence of SBAR. For example, if you're writing to an emergency department, or if you're writing an urgent referral letter, what do you think would be more appropriate? Would background detail would be more appropriate, or the details of current condition will be more appropriate? If the letter was being written for urgent referral, please type for me in the chat box. What do you think will you write first? Will you write background first, or will you write assessment first? You would write the current condition first, right? So in that case, you may not follow the sequence is bar, but you still have those paragraphs, right? So in that case, instead of having is bar, you probably would follow, first you would write the situation, then you would write about the current condition, then you may write the background, and finally the request. Right? So it's not that you should always be following the sequence. Paragraph functions may still be there. You may still have one paragraph on background, depending on whether it is relevant for the target reader or not, but the sequence may not always be the same. Situation will always be the first, but the bar, BAR, the sequence of those paragraphs may change. Am I clear so far? Can you all assure me that you would not always stick to the sequence S bar? You would use your logic or your medical knowledge to decide whether you need to write assessment first or background first. I want to ensure that there's no miscommunication taking place at this stage. Okay, now another approach that we have been discussing so far about organizing information is subject-based approach, right? We discussed that when we looked at writing session 2, when we looked at different types of letters and we kind of rearranged the paragraphs or rearranged the information. So one of the ways in which you can have your paragraphing is you can go with subject-based approach. Now in that situation, each paragraph may contain assessment as well as request, right? So here, when you are following the subject-based approach, you may not have one entire paragraph on background, or one entire paragraph on request, or entire paragraph on assessment, but each of the paragraph may follow the BAR format, the background, assessment, and request. Am I clear so far? So this is probably the typical structure of a referral letter, where you may have 4 paragraphs: situation, background, assessment, and request, and you will have to use your medical judgment to decide whether you need any tweak in the sequence of these paragraphs. Okay? The sequence may not always be SBAR, and this is what you can have for the discharge letters, and still you will have to follow your medical judgment to decide whether you would like to go with this part or this kind of paragraphing, or would you like to go with subject based approach. So each case notes are different in a way, and they require a different approach towards paragraphing, and that is where it is really important that you are utilizing that um, time in the beginning. Once you have reduced the task, once you have completed the task reduction, that's when it is time for you to decide in which way are you going to organize your paragraphs. Okay, or what would you include in the assessment paragraph, what would you include in the background paragraph, what would you include in the request paragraph, and of course what would you include in your introduction paragraph. And then when you are actually transforming the case notes, you'll have to make sure that the grouping that you did at the planning stage is followed when you are actually transforming it, when you are writing the letter. And that's very crucial, because if you don't do that, then you don't have time to erase everything and write it once again. If you realize that I should write this in the second paragraph, or I should have written this in the third paragraph, in exam you don't have that luxury of time where you can erase everything and write it once again. That won't be possible, right? So it's very important that you are able to decide it beforehand. The planning stage is very important. So now let us look at each of these types of paragraphs, and what are the some common collocations that will be used while writing such paragraphs. What are the things that you need to keep in mind while writing such paragraphs. So um, the first introducing situation becomes your introduction paragraph. And we have been discussing so far that your introduction paragraph should be really a brief paragraph. It should include the purpose of writing and the reason for referral, or the main issue for which you are writing the referral. These two things must be there. So look at these three examples, and which one do you think is the best? Can you reorganize them in terms of which one is the best, better, and good? The best should come first, then better, and then good. Reorder these three sentences in terms of which one is the best. The best one should come first, then better, and then good. Okay, so does everyone agree at least that one is not so effective? Why is that the case? Why is that the case? Why is one not the best one? Why is not the first one an effective paragraph? Yeah, multiple sentences, right? And when you have multiple sentences, it becomes like, start and stop, start and stop, start and stop for your target reader. Each time when, a multiple sentences are written, the ideas cannot be linked with each other fully, and um, as a result of that, the letter or the information may not flow very well. Right? So this all three tasks are giving the same amount of information, but here all the sentences are separate, and they are not linked with each other in terms of reason or purpose, or in terms of any relative clause there. Okay? So one way in which you can improve your introduction paragraph is by utilizing a relative clause. Uh, there is one entire video on relative clause, and you can watch that video to see how they are used. There are certain rules in terms of commas that you need to follow while writing relative clause in the introduction paragraph. So here you can see both of these examples. What is a relative clause? Is a sentence that you write with who, whose, okay, where, when, which, why. Using that helps you add some extra bit of information about your patient, and then you can write one sentence about their overall recovery. Let us look at a few more examples of introduction paragraph. These are three more sentences of introduction paragraph. Can you again reorganize them in terms of which one is the best, better, and good? Okay, so see here, apart from the patient's diagnosis, we have also added some background social information about the patient. So basically this appositive, this is known as appositive when you are writing a sentence with a or an, which functions as a further description of that person. So here basically these two sentences, he's pensioner and he's widower. So we have clubbed those two sentences into an appositive, widowed pensioner. So widowed is functioning as an adjective here, and pensioner is a noun. And then there are two ways. Here you have a relative clause, and here you have a sentence that's okay if it doesn't have a relative clause, because it is still a very precise description of what are we expecting from the target reader. So obviously here 2 or 3, if you compare both of them, third one is more precise, so third one is the best. Second one is it's precise but bit wordy, and first one doesn't have complex sentences, multiple simple sentences are there. And basically when you write multiple simple sentences, it would affect the flow of information that you're trying to convey, and it would also add to word count. Okay, so first one is very wordy, a lot of simple sentences, and that's the reason it is the good one, but not the best or the better. Second one is better because it has both appositive as well as a relative clause, but it is still a bit wordy. And third one is the best because less words, but still crisp information is given. Okay? So you have to keep this mantra in your mind whenever you're writing an introduction paragraph. It has to be brief and precise. Brief means it should not be very lengthy, it should not include a lot of details. Only the two things which should be clearly written is the purpose of writing clearly, and for which issue are you referring this patient. It could be in certain cases diagnosis, but in other cases it could be problems like impaired mobility or decreased appetite or being overweight. So it may not be a disease condition as such, but it could be a main issue for which you're writing the referral letter. And try including a relative clause or appositive to demonstrate your ability to write good summary and your ability to use variety of grammatical structures, but make sure that it doesn't become very complicated. Okay, so for that reason it's important that you understand the grammatical nuances that you need to keep in mind to ensure that whatever you have written is accurate. In order to make it you know a very long sentence, don't get confused in terms of using correct grammar. So it is important that you study different patterns of writing introduction paragraphs, and you have 3 or 4 different options with you, so that depending on which kind of letter you are writing or depending on what kind of situation it is, you can decide which one would you go with. But please ensure that all those formats you have learned are grammatically correct formats. Okay? So in exam, do not experiment. Whatever experiments you want to do it at the beginner's level or intermediate level. Don't experiment in the exam. Like if you have 3 or 4 structures in which you're planning to write your introduction paragraph, plan multiple times, okay, or practice multiple times using the same format, writing variety of introduction paragraphs, and then compare them with the sample responses to see if it is grammatically correct or not. And obviously, when you will be sending me your writing task, I would also be giving you suggestions if they are not written accurately. So now, keeping all the knowledge that I have imparted so far, can you try writing an introduction paragraph for this notes here? I haven't given you the full notes. I've just got the notes to help you understand who you are. You have the writing task here to understand who the target reader is. You have the plan here to understand why this reference is being written. And you have diagnosis and some portion of assessment. I want you to write the introduction paragraph, which is brief and precise. Please go ahead and type your responses in the chat box. If you will see, none of the examples that I discussed included age in introduction paragraph. That is because in the reference part, you are anyways mentioning the age. So there's no need to repeat age in the introduction paragraph. Another reason why I don't include an age in the introduction paragraph is because the reference line is not included in your word count, but the introduction paragraph is included in the word count. So it is always a good idea to write age in the reference line rather than writing it in the introduction paragraph. So as I said, when you are transforming case notes, you may need to add nouns, you may need to add prepositions, you may need to add articles, verbs. So here, as you can see, it simply says diagnosis and polylithiasis. Now, you will have to make a sentence out of it, and that process is transforming case notes into complete grammatically correct sentences. You'll have to decide whether you would use active voice here or passive voice. Which tense would you use? Okay, so I'm getting some very interesting paragraphs in the chat box. Okay, so uh, this paragraph, Shikha, has a lot of uh, errors in terms of when you are writing a letter to Dr. Andrew MacDonald himself, why would you write it is referred to? I would rather say uh, probably I would say I'm referring Mrs. Danielle Starkowitz to, or maybe who is diagnosed with polylithiasis, and then you will need to have comma on both the sides for further management. Okay, so this is how it will be grammatically correct. Uh, Another example that I've got here is Dr. Chinmay. Probably I would use this approach is suggestive of um, when the diagnosis is not yet confirmed. If it is preliminary diagnosis, then probably I would use this phrase suggestive of. Here, there's no query, the diagnosis is confirmed. Uh, and there is slight misinterpretation of case notes here. It says reassured regarding cancer. So maybe the patient is worried about it, and we have reassured them that it is not cancer because they have polylithiasis and not cancer. Okay. So that is where when I said the case notes will be given in note form, and your ability to understand them is being assessed whether you are able to interpret them correctly or not. So if you say possible of gallbladder carcinoma, that's misinterpretation because it says reassurance regarding cancer. We have reassured that this is not cancer. And I wouldn't say possible of, I would say possibility of. In any case, if I wanted to use the word with diagnosis. Okay. So I have one more here from Akshana. Again, the problem here is I wouldn't say it is not management of polycystictomy. It is management. Okay. So probably if I wanted to add polycystictomy, I would say including possible polycystictomy. We learned, or if you have watched the video of articles, I've discussed there that the uh, surgeries or operations will require article. So polycystictomy will require an article, and after the name, when you're adding who clause, that too will require an article. Sorry, commas. Um, okay, now problem with what you have written, Dr. Chetan, is that the who clause is always written after the name of the person you're writing to. You can't write it after your care. It has to be always written after the noun you are trying to describe. You don't need capital for disease condition. And if you want to add this for sentence, you will need a comma. And here, in fact, your sentence should end because you can't connect multiple sentences using comma. So this should be your new sentence. And when you are using may, it is not present tense. So you wouldn't add as es. No capital for surgery. Okay. Okay. Now the introduction paragraph that Priyanka you have written. You either use referral or request. Both probably would not be required. So you can simply say I'm writing to refer or request a referral for or request a referral of, not request for. So I'm writing to request a referral of Mrs. Daniela who has, and I wouldn't use Daniela, I would use Starkovic because we use their second name, who has diagnosed. It would mean that the patient has diagnosed. I need passive voice here. Who has been diagnosed. Okay. And then see if you're using who clause, then your sentence should end and you should be starting a new sentence. She requires further surgical management. Very good. I really liked the term surgical management. Okay. So when you are transforming case notes into complete sentences, you can also think about paraphrasing. How can you paraphrase? How can you write those sentences without using the same words from the case notes, and at the same time making sure that the meaning doesn't change. Okay? So instead of writing polycystic tummy, it could be a good idea to write surgical management. Very good. I like the way in which all of you have written the introduction paragraphs. All of you have ensured that it includes both the main issue as well as the purpose of writing. Uh, okay, Amita, your introduction paragraph is quite grammatically correct. A few errors, just a few. For example, if you are writing polylithiasis, diagnosis doesn't require article. And I wouldn't connect it with and here because I'm writing a different thing now. See, my first sentence is about diagnosis and the second sentence is about her requirement. So instead of connecting it with and, I would probably start with uh, a new sentence. Okay, so I have got another one here from Dr. Chandan. The reason I'm citing the name is to grab your attention so that you can know that I'm giving corrections on that. A referral for, yeah, this sounds good. So again here, when you're writing who, whose, which, when, where, those sentences, they have to come always after the noun you are trying to describe. So here you are trying to describe Ms. Starkovic and not obstruction. Right? So that will be considered as grammatically incorrect. So you would need to have this whose clause after Starkovic. Yeah, so here you can use this term for further assessment and surgical management. Okay, the most common error all of you are making is in terms of using commas. So a lot of you are connecting new sentences, multiple sentences with comma. That cannot be done. Remember, whenever you are starting a sentence with I am writing to refer, look at this sentence structure. Yes, this sentence is ending here. I is the subject, am writing is the verb, am writing to refer is the verb, and Mrs. Starkovic is the object. Now you are starting a new sentence here, who has a diagnosis of polylithiasis. So your second sentence is also ending here. Now you can't connect one more sentence with a comma. And I would not say has a diagnosis of polylithiasis. I'm sorry. I would rather say who has been diagnosed with, or probably I would say who has polylithiasis. Who has polylithiasis. Yeah, and here if you are connecting dependent sentence and complex sentence on the second position, then there should not be any comma. Okay, so this was Priya's response. Now I'm getting Akshana's response, and I hope all of you are noting the corrections that I have made in your original version. Okay, so I can't say I'm writing for surgical management. You can say I'm writing to request. And management of possible cholecystectomy is wrong. See, management of polylithiasis is being requested, isn't it? Management of surgery, how can we request management of surgery? No. So I would probably say further surgical management for Miss Daniel or Miss Starkovic. You will need a comma after that if you're connecting who clause. Remember, the comma after name comes only if you're connecting who clause after it. Okay, not every time after name. Who is diagnosed with cholelithiasis. Okay, now this sounds perfect. And I have one more here. Okay, so here in the response that you have written, Kamlesh, I can see some run-on sentences. See, I'm writing this referral for Ms. Starkovic. Here your sentence is ending. Now, how would you connect it with the next sentence is by adding who has been diagnosed with cholelithiasis. And this is repetition. Now she's being referring, or I'm writing this referral. You're repeating the same words. So instead of that, I would probably say she requires your expert opinion or intervention on surgical management. So different ways of writing introduction paragraph, and all of them are acceptable. There is no single way of writing it, as long as it is grammatically correct and as long as it is meeting two criteria. One is that the reason for referral, the main issue, has been written, and another is that the request has been written. It has to be precise. So it was good to know that all of you did not include these details of ultrasound. Okay? These details can be mentioned later on in the body paragraph about the result of the USG. Because the introduction paragraph is just a brief and a precise summary of the entire situation, introducing the situation, and then you expand it later on. Okay, so now let me show you two other ways of writing introduction paragraph for this particular situation. Okay, in fact, three. Hopefully you guys can see that. Okay, so I have added the word recently here. That aids their assessment that this, they have been having this problem only for a short period of time. It's not a long-standing problem. And this is another way. This is to request further evaluation and surgical management. And you can also start directly by writing the patient's name. So only when you are starting with patient's name, that's when you can actually add one more verb with requires or is being. So this is the common mistake that I see students make. They start with I'm writing to refer and then they end up using is being or requires, which is incorrect. Okay. If you are starting with I am writing to, you will see that after who clause, always the sentence ends, or You can add for further or for something, but you can't write a new sentence from here, or you can't write a sentence without subject. So if you are starting with I'm writing to refer, after who clause, your sentence must either and, or you can only connect noun phrase. You can't connect incomplete sentence like is being referred or requires. This is most common error, so be careful about that. Okay. If you want to follow that format, then you will not start with I'm writing to, you will start with Mr. Kovic. So that becomes your subject. Okay. And then you have a who clause to give further information. So actually your sentence is like this. Mr. Kovic is being referred, right? And this sentence is giving additional information. So whenever you want to use who clause in between your sentence, try to read it like this and see if that is meaningful. For example, here if I write, I'm writing to refer who has been recently diagnosed with cholelithiasis, and if I write requires, okay, let us do that. If I write requires here, and then if I cross out this, how would the sentence read? I'm writing to refer Mrs. Starkovic requires. Who requires? No subject. Right? So the simple logic of subject, verb, and object. This is your subject. This is your verb. And Ms. Starkovic is your object. Now you either and the sentence here. If you don't add and, then you add a who clause. And the who clause is just a further description of Mrs. Starkovic. So after who clause, your sentence must and. Or you can only connect a noun phrase. You can't connect sentences like is being or requires. Are you all clear so far? You may be able to get some more idea on this if you refer to relative clause video about the nuances of grammar that I have been discussing. Any questions so far? Please let me know. Shall I move on to the next task? Okay, so now let us look at another task. We are still on introducing situation. And if I show it to you once again here, because now we are moving on to the discharge summary. So as you can see in the discharge summary, while writing introducing situation paragraph, you must include the reason for admission, date of admission, their current status, and obviously the request. Okay. So now let us look at this task here. Again, I haven't given the full notes. I've only given the essential details that you will require to write the situation paragraph. Medicine students should look at the medicine criteria, the medicine notes, and nursing students should look at the nursing notes. Please go ahead and type your introduction paragraph in the chat box. Okay, so some of the other things you will need to keep in mind when you are transforming case notes into complete sentences is making sure that you are not using acronyms which you think the target reader may not be familiar with. So in this case, you are writing a letter to the nursing director, and they are working in a nursing home. They may not clearly understand the term ORIF in the first go. Probably if you explain in the first go what ORIF, and later on if you refer to the term ORIF, that would be okay for them. So it should be expanded. What is ORIF? Similarly, just saying ORIF is not enough, because ORIF on which leg or which bone, isn't that also important? Because ORIF can be also for fracture in the hand, it can be for fracture in the leg, again whether it is left or right. Okay, so precise means it should, by looking at the introduction paragraph, the target reader should be able to visualize the problems that the patient may have had. So it's important that you clarify those things. Another thing that I would like to change here is this is to refer for transfer. Instead of that, probably you can say I'm writing to transfer Miss Sands into your nursing home for recuperative care. You could also have replaced this word recuperative into rehabilitative. Okay? So paraphrasing, expanding, using appropriate prepositions, these are the things you will need to keep in mind when you are transforming case notes into complete sentences. Okay, I have another uh, sample response here. Um, Shikha, writing your introduction isn't necessary, because you will be writing that in the sign off. So there's no need to say who you are. You can simply say that you are writing about Mrs. Mary. So you can probably say Mrs. Mary has been treated, or Mrs. Mary was, sorry, Mrs. Sen was admitted. Okay, again, having is a spoken expression. So I would say due to, due to the fracture of left femur. Again, you are mentioning fracture for the first time. So you would say a fracture of the left femur. Okay. And for that is not an expression. You can either use for this reason or for therefore. Till her recovery period. That's fine. I suppose you need to review the articles and capitals. You need to have capital letters while writing the names. Okay. Got the next one from Dr. Chandan. Okay, sounds like a good paragraph. But hence, if you are using, you'll need comma after hence too, because it is a linker. And then you will need a complete sentence. Hence, she will require recuperative care for complete recovery. Okay. Okay, Amita, your introduction paragraph is appropriate. Remember, after who sentence, do not connect a next sentence with and without having the subject, because as I said earlier, I is your subject here. Okay, so and the who sentence and start a new sentence. And she is being discharged. In passive voice, you always have ed form of the verb, and here you will need a comma. And in complex sentence also, both the sentences will have subject. So she requires 1 month of recuperative care. But I would be more explicit here. Um, instead of repeating ongoing care and recuperative care, they both are the same. Instead of that, maybe I would use the word transfer, because I'm actually transferring the patient into their nursing home. So instead of using the same term 2 times, I may try to include the transfer word in my introduction paragraph. Dr. Chetan, your introduction paragraph has too many details. It has to be brief. You can write details later on in the uh, body paragraphs. Instead of writing that she walks 10 to 15 steps, you could probably have used terms like uh, slow progress, or you could have used terms like impaired mobility or limited mobility, right? So that is where your ability to use language is being assessed, right? So if you are able to use different grammatical structures, you will be able to keep it precise. So probably I would say she is she is transferred, or she is being transferred, because it is continuous tense, under your care for further motivation and full recovery. Okay, and if I wanted to add why, I would say as she has limited mobility, she is being transferred under your care. So that's where your ability to use language is being assessed. Okay, so instead of using the term refer akshana, probably you could add the term transfer. Otherwise, your introduction paragraph is appropriate. Okay. Here, your introduction paragraph is precise, but it lacks details of her recovery. Uh, and assistance is uncountable, so I wouldn't require article. So I'm writing to request assistance from assistance with activities of daily living. Now this probably would be suitable if I was, requesting a home visit uh, only for activity of daily living. Here, are we writing this only for activity of daily living? The patient is actually being transferred into their care, isn't it? So instead of writing the term request assistance for activity of daily living, probably I would use a more general term. Um, or clarify that they are being transferred. Okay, Dr. Chinmay, your revised introduction paragraph seems good, but for ORIF, you wouldn't need capitals. I think in first paragraph, just writing impaired mobility or limited mobility, or because of decreased mobility would be enough, and then you can expand that later in the body paragraph as to why she has limited mobility. Okay, so now let us look at some of the ways in which this introduction paragraph can be written. So you have two examples here. It is quite similar to what all of you have written, but these are two grammatically correct ways. So if you want to add one more sentence with is being transferred or without any subject, then you must start it with the name itself instead of writing with I am writing to refer or I'm writing to request. And see, this is one very good way using following. Okay? So this helps you write both the things in the same sentence. Why she underwent ORIF. Or you can also use due to here, due to. And mentioning the date of operation, either the date of admission or the date of operation has to be mentioned. Right? And the term recuperative care can be paraphrased with complete rehabilitation or complete recovery. This is another example where the term admitted is used. So here I haven't used the term admitted, I directly went on to write about the surgery. But that still gives a clear idea, right? Having the surgery automatically would mean that they were admitted. And instead of using the term discharge, I've used the term transfer. And you can use terms like this: recovery has been slow, or she still has limited mobility, or rehabilitated care. Right? So are the ideas about transforming case notes now clear? You may need to interpret first, then you may need to think how would you organize it in a sentence, which two case notes will you club together. Then you will have to think, you will have to add the subject, the verb or helping verb. In certain cases, time markers, adjectives, adverbs. For example, limited mobility. So limited is an adjective. Uh, recuperative is an adjective. To paraphrase, you can say for rehabilitation or for rehabilitative care. So you may need to paraphrase some of the words, and you'll have to ensure that the use of articles and prepositions is correct. For example, here the name of the surgery. Here I haven't used the term surgery, and therefore I need article. Okay? So both the time. Similarly, for writing about symptom, like fracture is a symptom, so you need article there. So are you all now clear on what are the different ways in which introduction paragraph can be written, and how can you ensure that it is grammatically correct by remembering that you may need to add subject, verb, helping verb, preposition, article, and in certain cases adjectives and adverbs of time to summarize the case notes without writing too many different sentences. Okay, Now let us look at, there's one more example here, and I want all of you to do it as an extension activity. I would be uploading the uh, example answers for this too. Now let us move on to background paragraph. Now for writing the background paragraph, there are some commonly used collocations that you can use. So I have got you a list of commonly used collocation. If you can take a screenshot of this. These are the commonly used collocations when you are writing. Yeah, so this PDF will be uploaded. Don't worry. It will be uploaded once the recordings have been done. For now, you can take the screenshot. So you can see that mainly you need to pay attention to the collocations of the verb and prepositions. For example, attend in my clinic. Now you can use in if you are writing a month or a year, but you need on if you are writing a specific date. And you may not need any preposition if you're writing expressions like today or 6 weeks ago. No preposition at all, right? If you are using complaining, you will need preposition of. If you are using symptom suggestive, you will need of. So I have highlighted those collocations. Suffering from. Okay. Similarly, difficult to, unable to. But if you're using noticed, experienced, or reported, no preposition. Similarly, instead of saying she had a fracture, you would say sustained a fracture, contracted infection, underwent operation, diagnosed with, admitted for if you're writing the, the procedures for which they were admitted. But if you're writing diagnosis, then admitted with. Right? So it's important that you are getting familiar with the collocations of verb and the preposition, which verb is used with which preposition. So you can ensure that the sentences you are forming are grammatically correct. Have you all taken the snapshot of this? Let us move on to the next activity where I have got another set of case notes for you. And you'll see that I have already done the selection because what we are trying to target today is transforming the case notes. So I've only got a section of the notes, and from that too you can see that I have ruled out some of the information. So you only need to write the unticked ones. Go ahead and summarize this details by using the expressions that you have from the screenshot that you have taken. Make sure you are trying to combine more than one notes into single sentence so that you don't have too many simple sentences written here. And here you may also try to use some of the linking words that we discussed last time, such as associated with, as well as along with, coupled with. That may help you summarize more notes into one sentence. You may also try using relative clause here for describing symptoms. Make sure your timelines are correct. You have 3 timelines here. They presented to you on 21. This is something that happened on the previous night. This is something that happened 10 days ago. And you are writing this letter on 23. Right? So this is a real challenge for all of you here. And you may need to use perfect tenses here. to make sure that your timelines are clearly described. So you have four things here. When you're writing the letter on 23rd, this is the detail of their visit on 20. And then on 20 also they reported two separate episodes, one that happened on the previous night and one that happened 10 days ago. Okay, go ahead. You may take some time, but make sure that you are accurately summarizing these details. Okay, so 2 more minutes for all of you to start to send your responses. Make sure you are quick enough so that we're able to practice more notes, more tasks. Okay, so got first response here from Amita, and let's see how the timelines are infusing here, because you're writing this letter on 23rd and the patient came to your clinic on 20. So if you say today patient came to my clinic, it is wrong. Um, some other errors will be, it should be the patient, or it would be better if you write the name itself. And which has been present, not presented. Has been presented will become passive voice. You need active voice here. Okay. So here you first need to change the timeline, that on 21 2007 the patient came to my clinic. Do not use the patient very often. Instead use he or she. Okay. And here, if you will say has been experiencing, has been experiencing worse constant pain. Here, the task says that the pain was for 2 hours. So right now, they probably don't have the pain, but they had an episode of pain which lasted for 2 hours. So then this will also be slightly confusing for the target reader, because you are saying has been experiencing worse constant pain with the duration of 2 hours. What does that mean? Like Um, and again here, so you are writing about the visit on 21, and on 20's visit it is written last night. So this doesn't mean that right now it is last night. Are you getting my point? You are writing the letter on 23rd. So this is not about 22. This is about previous night on 20. So the timelines are not clearly written here. See, these are all the notes under this date, 21 2007. So last night here becomes 19th 1 2007, isn't it? Okay. So again, Shikha, what you have written is a very long and wordy summary with a few misinterpretations. Like just like as I said, last night here is not last night, it is date before on 20th when they came to you. It should be she doesn't like fatty food. And then uh, you may not add phrases like uh, you may exclude writing phrases which are normal. For example, when there is no change in the vowel pattern, you can exclude that because there is nothing abnormal there. Um, so hematemesis was also not there. So if it wasn't there, why would you write it? Only if you think, it is necessary for ruling out differentials, then you may write. For example, if I was thinking about two differentials here, arthritis and rheumatoid arthritis, then I may mention that, or rheumatoid arthritis and gout, for example. Then I would mention that there was only one joint and the other joints were normal, so it's easy for them to rule out rheumatoid arthritis. But in this case, particularly when the diagnosis has been made already, there's no need to write the normal findings. That is why I've excluded those things. Um, Freya, in your response, you have written the examination was unremarkable, but you don't have any details of examination as yet. So how can you possibly say that the examination was unremarkable? You can't add something from your background knowledge. You have to just transform the notes. And you also made the same misinterpretation the last night here. See, all these details are of a specific date. Okay? On this date, they told you that 10 days ago they had it, last night they had it, but you are writing this letter on 23rd. So this is not the last night. Okay. Uh, I think this is something I should discuss here. This is Akshana, your response. So presented is active voice. I wouldn't say was presented due to abdominal pain. Now you could possibly here add the uh, adjective colicky abdominal pain. Uh, Unlikeness of fatty food is wrong. You would need to probably say dislike of fatty food. This sentence can be excluded because they are all normal findings. And this last night is again a misinterpretation. and it was worse, not worsen. And if you are trying to say that there was no blood, probably you would say but there was no blood in vomit. See, this is how transforming case notes is different. You will need to add helping verbs. You can't just say no blood in vomit. It is a note form. Okay? But there was no blood in vomit is a sentence. Okay. Another example I have. Uh, why would I write a review today? Because this is the first visit that they had, and I don't have any information about today because today is your 23rd. You're writing the letter on 23rd. Here you only have information about 21 2007. So using the term review is not appropriate. And one thing that I noticed all of you have missed here is that the pain was occurring after meals. Isn't that something very crucial for making diagnosis? Yes. But if you say he had severe colicky pain since 2 hours, it is a misinterpretation. When they presented to your clinic, they didn't have pain for 2 hours. They had pain on the previous night after having their meals. So here the grammar is something very, very important. You need to use. That is the reason your knowledge of perfect tenses is helpful. Let me now show you the correct summary. I thought I would be able to get at least one good example, but no, a lot of misinterpretations. No worries. Let us look at some good examples. Okay, so see, this is possibly one way. Okay, this is not the only way, of course, but possibly one way in which you can summarize the information. Right, so I'm writing all about a visit on 21 2007. So I would start with Mrs. Starkovic first presented to my clinic on 21 2007 as she had experienced. Do you all remember we discussed past perfect tense? We use it when we are talking about two events of past. So one event is her visit on 21. I'm writing the letter on 23rd. So 21 is the visit. And the pain that they had was even before that. Last night, it says. So had experienced an episode of epigastric pain. So it is not that they still have it. It was an episode on the right side of abdomen. Again, very important. The previous night after taking her meal. So particularly when you're writing referral letters that help the target reader make diagnosis, it's important that you are writing the description of that symptom clearly and as well as the associated symptoms. So always first try to describe the main problem, the main symptom, and then the associated symptoms. So here, what type of pain it was, whether it was constant or episodic pain, whether it was triggered by certain things. So here, after meal, it was, and then you express how it was persisted for 2 hours and was associated with vomiting as well as aversion to fatty food. There was no relief in spite of taking 2 tablets of aspirin, and she reported a similar episode 10 days prior to the visit. The visit on 21 2007, 10 days prior to the visit. So timelines should be clearly written while transforming case notes. Your sentences should be complete. There should not be any note form. Okay, I have got one more response here from Chandan. Okay, so let me discuss that. Okay, I would say the patient because I'm talking about a specific patient. Previous night of her visit, so I would say on the previous night of her visit, she had episode of abdominal pain, which was constant, colicky, and was associated. An episode. Yes, A is episode. When you pronounce it, it is a vowel sound. So an episode. Okay, good attempt. One of the best summaries from whatever I have got today. Right. And probably mentioning the right side so late in your paragraph, it would be better if you could mention it here itself, episode of abdominal pain in the right upper quadrant or on the right side of abdomen. So they get a quick idea of where exactly the pain was. Right? So always describe the main symptom first. Be clear about the timelines. Make sure that your location is clearly mentioned, and then any associated symptoms or the treatment that your patient may have received. Okay, let us practice one more background paragraph. This time it is for the discharge summary. But for that, you will need some collocations for treatment, recovery, and complications. So I'm getting them here first. Maybe you will need to take two screenshots because it's a bit lengthy. So please take the first one. Here also notice the use of verb collocation with preposition followed by in addition to, combined with, advised on, commenced on, changed on, started or commenced on. So it's important that you are using the right preposition. And take another screenshot for operation, recovery, and complications. If you're familiar with this verb collocations, you can ensure that your sentences are grammatically correct. Okay, so now let us do this activity where again you need to write the background paragraph, but this time for discharge summary. If you want me to show what the background paragraph of a discharge summary must include, it's here. It must include treatment or medication received, any complications that the patient suffered from, and details of patient's recovery status. So we have already written the introduction paragraph, and all of you know that we have mentioned already why they underwent surgery. Okay. So now in the background paragraph, you will be writing more about their progress after the surgery and if there were any complications that they suffered. Okay, so you have got the notes in front of you. This is the second letter that we looked at earlier, Mrs. Mary Sands, who is being transferred into the nursing home, and have already excluded the irrelevant notes for you, so don't include them in your summary. Maybe you can exclude this too, because now it is no longer to be continued. And similarly this, because if you see the current dosage is this, 1 a day. Minimal pain after 4 days, cocodamol reduced to 1 a day. So this is the dose, initial dose, but currently this is the dose. So rather than writing the previous dose, you can write the current dose. We have already mentioned that they underwent ORIF for left femur, so that can also be excluded from this paragraph. All these things we have already mentioned in the introduction paragraph. Now you need to keep in mind that you are writing this letter for the nurse working in the nursing home. So you should know how much would you expand, which notes would you expand, and which notes would you summarize. Probably you may not go on to write the details of the physio things here because that's something the physiotherapist will deal with. Okay, so now if you have tried writing the summary for this, compare it with this and see if, if to what extent were you able to make a precise summary and whether it was grammatically correct. Look at this summary here. Now directly we have started this from post-operatively, since we have mentioned the details of operation and admission in the introduction paragraph itself. Ms. Tarkovas was found to be disoriented with some hallucinations, which resolved after discontinuing IV morphine. So this again is a way in which you can make it smaller with less words. Instead of writing that because of that the morphine was discontinued and after that risperidone was started and now she doesn't have any hallucination. Instead of that, using this would be helpful. Nevertheless, continued monitoring of her orientation status is recommended because it says monitor post discharge. Then another sentence is about her wounds. So although her overall condition and condition of the surgical wound has improved with no further complications, we are using a complex sentence here to highlight the point, which is something the target reader will have to be alert about. Right? So instead of writing about the details of power and the physiotherapy sessions, probably we would only write those details which are helpful for the nurse. So if you tell her very limited mobility and if you describe how much can she walk, that's probably enough for her. And that is why she requires assistance with showering, grooming, and about her pain. So again, in one sentence, we have mentioned everything. Here it says that minimal pain that she has and cocodamol was reduced to 1 a day. So instead of that, we have directly written just one sentence because see, the pain is no longer a problem, right? She only has minimal pain and there's one medication that she needs to take. So it is a complex task transforming case notes into complete sentences. Okay, a very good summary, Priyanka. Kudos. Very good summary. Although some rectification needs to be done, but a good attempt. She was treated here with morphine postoperatively and now has been placed on or is placed on cocodamol. And then for frequency, you will need a comma. But may feel anxious would be more appropriate. And due to this, if you are using, then you would need a comma. She can, if you are using can, then no SES. And so is spoken, so you may replace it with therefore or as a result. But a good attempt, very good. Okay, so this is how your background paragraph for referral letters and discharge summaries might be different slightly. Because in discharge summary, you're focusing more on current condition. So your background paragraph will not be very lengthy. You will try to keep it only to the main ideas rather than including the details. So here I would not include this. I would probably directly say post-operatively. She was started. Okay, very good, very good. But probably now you understand how it can be less wordy. Yeah, and to be more specific, how much cocodamol is to be given? That's something you should be mentioning because probably the power is not that important for the nurse. As you know that it is the physiotherapist who will be looking into these things. The nurse probably would be more involved with the medication part, so she needs to know the dosage of medication for sure. Okay, but anyways, good attempt by both of you. Very good. Chandan, you can work on how you can make it less wordy. Okay, now this session is going to be slightly lengthy because we still have to do the request paragraph. So those of you who are getting late, maybe because of your jobs, can leave the session and then you can later on make sure that you are checking it out. You're checking out the recordings. So now we are moving on to request paragraph, and I have got some very good activities here for you. So these are the possible sentences that you may use in the request paragraph, but here instead of giving you the sentences as collocations, I want you to collocate them. So I've got you the verbs and I've got 4 prepositions here. I want you to choose appropriate preposition for each of the blank. Quickly go ahead and type your responses in the chat box. Write the number of blank and preposition along with that. Do it. See how quickly are you able to do that. Okay. Yeah. So some correct responses I'm getting. Or first one is assess the cause of her symptoms. Very good. Take over the care again of this patient. Compliance, we use compliance with the medication. Advise again with this patient. Very good. Advise. Okay. What preposition do we use for advise? We use on. Advise on something. Very good. Educational materials. Okay. Now, educational materials for what? So please provide educational materials on the long-term risks of childhood obesity. Materials on the long-term risk. Okay. And here we are using advise as a verb, and then you have another verb after it, right? To take. So here I would not say advised on take, because if I use on, then the following should be the noun. Okay? So on is always followed by the noun, but here take is a verb, so to is followed by take. So seventh will be to. And I can see that um, Priyanka has got one or two wrongs, but otherwise overall correct. Priya has got a lot of them correct. Discuss, we always use discuss with, isn't it? I will discuss it with someone, not on. On is for topic. We are going to discuss on certain topic, but if the person you are talking about, then it should be with. Okay, and Akshana also has some of them correct, particularly fourth and fifth, uh, fourth and sixth. I see some issues with. Okay, now the next task here, task 5. Again, you have some sentences that can be used for request here. So let us do the alphabet A activity first and see if you can fill in the gaps. Now here, you're not just going to fill in the gaps with the verb as it is. You will need to change the verb form. Okay? So you will also need to take care of the tenses. You may need to add helping verb. You may need to add ses, ed, or you may need to use it as a noun. You will need to change the verb form if necessary. Again, please type the number of blank for which you are writing. Okay, so here again, being familiar with collocations is something very important. So here, compliance, we always use this with either monitor or ensure. So I would use ensure here, ensure the patient's compliance, I would say. As I said, you may need to make changes to the form. Compliance with the recommended exercise program, and here you can use assist because regaining strength. So assist her in regaining strength of left shoulder, and Mrs. Martin has been here. What would you use? Okay, here a lot of you have got it correct. That's good. Advised, yes, has been advised to refrain from strenuous activities for a month. So see, transforming case notes, as I keep on insisting right from the beginning, is a complex process, and that's something where your level of English is being assessed. Okay, and in order to make sure that you are able to get good score there, you will have to practice writing a lot and then comparing it or checking the patterns that are used in the sample responses. Okay, now go ahead and write it for the second one. The B, alphabet B now, this one. Okay, yeah, correct. Assessment and definitive diagnosis, yes. Yes, very good. Management, okay. And what would I write here? It's important the patient we lead as, isn't it? Because this is a singular noun. We add as an es if the noun is singular. So if the patient adheres, it's important the patient adheres to this medication program. Okay, very good. Some of you are going great. Okay, now the third one, alphabet C. Okay, Akshana, very good. All of them are correct. So take care, yes, take over care of the patient and provide what? Provide we use with support. So these are also collocations. There's the collocation of a verb and a noun. And yeah, liaise, we use it liaise with, liaise with social services. So this is the familiarity of these collocations can ensure that Your sentences are grammatically correct. Apart from, whatever we have been discussing so far, the tenses, the active and the passive, the compound complex structures. Yeah, very good. Now the fourth one, the alphabet D. And see if you are able to write for this too. Again, very good, Akshana. All three of them are correct. Dr. Chinmay, both of your answers are correct. Third one is also correct. Very good. Priya, very good. All three of them are correct. But notice it is advise SE, not CE. Yeah. So it is perform an assessment, provide, advise her. So advise here we are using it as a verb, so it is SE and not CE. And finally, provide. Okay, so these are some collocations you will need when you are writing a request paragraph. Okay. Now, can you think what would be the extension activity from the trend that you have seen over the last 1 month? What do you think I may suggest you as an extension activity? You can predict some of the things that the teacher will do next, right? So what do you think would be your extension activity? To write a full letter, yes, okay, but that could be a daunting task. For now, what I want you to do as an extension activity is write a discharge paragraph, the request paragraph for this discharge letter. Okay, writing request paragraph for this discharge letter. That's what I want you to do as an extension activity. Right? And then another thing that you can try doing is writing the request paragraph for the physiotherapist. Okay? So there is one more task that I have included right from the beginning. So let me now clarify what all things I want you to do as an extension activity. And all the resources are there in the PDF itself. So we tried writing the introduction paragraph for this referral letter. We also looked at different ways of writing the introduction for discharge letter. Now I want you to write introduction for allied healthcare professional, and in this particular case, it is writing to a physiotherapist. Okay, so for writing introducing situation, this is the extension activity that you need to do in task 1, letter 3. Then for writing background paragraph, we tried writing about the complaints, but I want you to write the physical examination finding and test result paragraph. Sure. Again, I have selected the case notes already and excluded which are not necessary. Right? And for treatment, again, we have already practiced writing for the nurse, but you can try practicing for the treatment for physiotherapist. How will you write for physiotherapist the background paragraph? So that is practice for background. Now, one section which I haven't discussed, and because it doesn't require much explanation, is how to write the medical history and medications. Now, medical history and medications are more to do with selection of information, because transforming it is not very difficult. So I have given you some of the ways in which some of the common collocations that you will use for describing history, allergy, risk factors. And based on that, I want you to write this short paragraph on additional details. This activity we completed already, and for I want you to use all those expressions and write a request paragraph for this discharge letter. This one is for the nurse. As you know, I have mentioned it as a discharge letter. And letter 3 is completely pending. As you know that you need to write the introduction paragraph, you need to write the background paragraph, and you also need to write the request paragraph. So if you want to try practicing the whole letter, then you may try writing this one, writing to physiotherapist, where you will be writing the introduction paragraph, the background paragraph, as well as the request paragraph.